Welcome to the new era of personalized healthcare. I'm Minna Hendelin. I'm coming from Sitra, the Finnish Innovation Fund and think tank. And I'm very pleased to be here today in this great session, and it's my great honor also to moderate this panel today. The panel, which consists of different players of health sector ecosystem in Finland. Today we have here the Seppo Heinonen, who is a professor, director, a medical director from Helsinki University Hospital. We have representative for Finnish government, Mr. Jukka Lähesmaa. He's a senior advisor, permanent secretary's office, Minister of Social Health and Health in Finland. And then we have a representative for Fujitsu, development director Ville Vaarara. Welcome, gentlemen, for this interesting panel.
Thank you.
Need for a radical redesign how we deliver, practice and think about healthcare is emerging across the world. Health systems are under pressure in the face of changing demographics and rising costs. Also, demands from citizens, private actors and public institutions are challenging the shift of care from reactive sick care to smart, personalized and sustainable healthcare, emphasizing prediction, prevention and participation of people. In this panel discussion today, we will focus on how to build personalized solution for healthy living by using data and digital platforms. And we will also highlight different roles of public-private partnerships and ecosystem players. So let's jump to the first question immediately. Jukka, government plays an important role in building enabling environment for research and innovation and also businesses. Digitization and better use of data is in the focus of government agenda in Finland. And Finland is one of the leading countries in Europe in extensive use of health data, according to the very recently published report by Open Data Institute, for instance. Could you tell some examples of Finnish government actions in this sector?
Yes, thank you, Minna. The Finnish government indeed thinks that digitalization and innovations are needed to make our care system better and benefit the citizens. And the role of the government here is to create enabling legislation, innovation-friendly legislation, and also ensure easy and secure access to the data, but also facilitate ecosystem building where the different organizations, both public and private, can cooperate. And then let me give the examples. First of all, we have been for decades now building our national health and social data and service system called Kanta. And now we have 100% coverage of the electronic patient records in this system, and also all the prescriptions are done with it. And now we are working very hard to also include the social care customer records into the same national system. And actually, Fujitsu has played a major role in this system development. Then the second example is about the secondary use of data. Some years ago, we noticed that we are not fully utilizing our extensive records for the research, innovation and knowledge management activities. And to fix this, we created our new act on the secondary use of data. And based on the act, we also established a new permit authority called FinData. So FinData is able to give the permit to all the different registers in Finland. But it's not only giving the permit, but it's also collecting the data from the different organizations, combining it and providing it to the customers.
Thank you, Jukka. And yeah, definitely the law of secondary use of health data is very rare, even in the global terms. And there are only few countries in Europe who has such a service operator that FinData is now operating in Finland. Hey, that's very great news. Okay, let's jump to Seppo. So CleverHealth Network is an ecosystem where IT, medtech and pharma companies are developing together data-driven smart solutions for unmet clinical needs together with clinicians and academic researchers. Could you open up the need for such kind of collaborations and tell that what has already been developed in this unique platform?
Yes, thank you, Minna. We at HUS at University Clinic, we are working together with commercial companies, in this case with Fujitsu, and we have also collaboration with other universities and so on. Also international collaboration is going on. EMOM is all about self-management of gestational diabetes. The key components being continuous online glucose monitoring and self-tracking of diet and physical activity. This data is then made visible to the patient and to healthcare professional. And thus the treatment is in a way guided and led by healthcare professionals. But this allows the personalized way to interpret the data. Glucose homeostasis is in fact a balance between these components, and we think that making this visible, we get a more personalized way to look at the disease. In the future, we will also use artificial intelligence to interpret and guide the treatment, and I think that's the future.
Thank you, Seppo, and this is really great things if you think about the holistic approach to people's health and well-being, and this kind of platform where you have medtech, IT, pharma cooperates, researchers, and healthcare organization working together. Hey, then we go to Ville, and Fujitsu is an active partner in CleverHealth Network, so an important player also in larger scale in Finnish health ecosystem. So why Fujitsu joined CleverHealth Network, and why Finland? What is it so special to do these things in Finland?
Yeah, I think the first of all it comes for the question that what is the maturity level of the area, that what are the possibilities to innovate on top of, and I think that in Finland we have a really good environment for creating new digital solutions. As Jukka stated, 100% coverage of EMR data, and we have the legislation on place in Finland. But of course, if we think about European level, there's lots of initiatives in EU. For example, joint data strategy, common health data spaces, and so on. So, and Finland is part of the European. So we need to be ready need to be ready and participate into activities. When it comes to the CleverHealth Network, I think it's a perfect opportunity for us to work closely with public organizations like Helsinki University Hospitals, research partners, universities, and also with other companies, large, small, medium, and startups. Because when we are building new solutions, we need to be able to collect all the crucial information to able to be sure that the outcome will actually provide the quality, the efficiency, the well-being or health living what we're trying to achieve. And then we come to the process of, I think, outcome-based healthcare. And if we want to, as IT company, support the healthy living in the world, we need to be involved also to create those solutions which are provenly working in health living, in the aspect of healthy living.
Thank you, Ville. So it's not only your playground is not only Finland, it's actually the whole Europe, and it is an access to the European expertise and markets. Great, wonderful. So well, now we have time for one last round of the question, and so how does the future look like? What is the most important thing that needs to be done? And let's start from Seppo this time.
Thank you. First, I think we need good news and we need success stories, and I hope that EMOM will be one of those success stories. Secondly, we need solid scientific evidence to show that this kind of treatment is safe and it's efficient and it's also convenient for the patient. And finally, we need a common understanding that this will be the future in terms of healthcare, in value-based healthcare.
Great. Good points. What government need to be done, or what's your perspective from that sense?
First of all, it's important to notice that it's a lot of going on in the international forums right now. For example, the global policies and cooperation that United Nations and WHO are facilitating now. And EU wants to be leader in the data-driven society and building the single market for data in Europe. It's highly important. And Finland wants to be part of this development as well, of course, and bring our sometimes quite unique experience into the international tables. An example of that is our major role in the European health data space developments. Then the second thing that I like to mention is the prevention and focus on well-being. We have been earlier put effort on the data management of sick people, but as Ville mentioned, in Finland and in some other countries as well, we have such basic digital infrastructure now in place that we can focus on more advanced services. And by that I mean services that really can empower the people to take care of their own well-being and health, and also make the communication between the professionals and customers better.
Yeah, surely, and this COVID has definitely boosted up this
Yes,
international
indeed.
collaboration and these data-driven solutions. What about Ville? What needs to be done?
I think that what at least we need to done is to break down the silos. And by the silos, I mean also the industrial silos. One example is that one of my friends, one clinician asked that Ville, how far away is your nearest health station? I said, okay, in Finland we have quite good coverage of health stations. It's like, I think 1 kilometers away. And he said, wrong, your nearest health station is the nearest grocery store. And it's also about this initiative about the EMOMs. So we are what we eat. And if we want to create new solution, we need to break the barriers between the traditional healthcare, between the living habits, between well-being, how our whole society is planned and kind of directed or governed. That's kind of the industrial level. Breaking silos in the industrial level, but we need to break silos also between the vendors, customer, public organizations, research organizations. So I think in the future that's the only possible way to be able to create those new solutions is by doing those together within ecosystem, with using and utilizing all the best information, knowledge, what is available to make sure that those solutions are working on the future and also working to bring the good life and healthy living into our society.
Well said. Thank you, Ville. Yes, the health sector has been behind other sectors in harnessing the power of digitization, exponential technologies like AI and the data. 2 decades into the 21st century, and this transformation is yet to occur in health industry now. We see the germination of fresh transformational ideas and capabilities evolving in different places around the world, and one of those places is Finland. Our panelists brought up a great list of actions, and I will wrap it up them here like this. We need to increase common understanding and create value-based evidence for innovative solutions. We need to build enabling environment with harmonized policies and guidelines. And then we have to break down the silos and develop new models for co-innovation and businesses. So welcome to the new era of personalized healthcare. And I'd like to thank our great panelists and audience for attention. Thank you.